Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show. And today we're having a special podcast, coming to you live from match day, almost 10 o'clock. Match results have been out, oh my goodness, probably, 15 hours? I don't know. About 15 hours. And we're going to be sharing in the success of one of my former residents who's going to be going back to training, but back to training in pediatric dentistry. I have Dr. Osbourne here. Congratulations! Woo! Doing your dance. You're going to be doing the dance. I knew. Because last time we talked, you were warming up.
Yeah, I was warming up. I was like,
you were cabbage patching or something. I don't know
have
what
this dance ready.
I don't know what the dances they call now. My son is. I don't know, but you definitely have a reason to celebrate today. So I'm going to have you kind of just talk a little bit about your experience in applying the PEDO, getting your match list together, and share with your news. But first of all, congratulations. So tell us a little bit about yourself and where you went to dental school, where you did your residency, what you're doing now, and why pediatric dentistry.
Okay. Well, I'm trying to think where it all began. I went to Loma Linda University in California. After that, I wanted to come back to the East Coast, to New York. So I ended up at Bronx, Lebanon, where I did my GPR. Then I went to practice upstate at a family health center for 2 years. And while I was there, I had the chance to work with tons of children, and I realized that I liked working with children better. And I also met a couple of pediatric dentists, and they really encouraged me to go back. So I applied my probably like a year and a half, like a year out of residency, and I didn't match last year, but I had decided I really wanted to do it. So I tried again this cycle, this time trying to use more of my resources, trying to find a different route. And in not matching, I also had the opportunity to learn about the special care dentistry fellowship, which I'm doing right now at Stony Brook. And I'm applying this cycle. I applied this cycle, and thankfully I matched this year now.
Yes, you did. So where will you be taking your dental talents to in July 1st of 2019?
I will be going to St. Barnabas, my #1 choice. And I'm so excited. It feels really good. Last year when I didn't match, I knew I wanted to go there. And this year that I had the opportunity, I'm really excited too. It's like it came full circle.
Right. Now did you apply there last year as well?
Yeah, I applied there last year too.
So what was the difference for you, at least with that program? What do you think made the difference after you applied the first time in that program and weren't selected at that first round, and now you went back for round 2 the following?
I think the fellowship helped so much. The fellowship, I feel that it made me stand out amongst the other candidates. A lot of them, oh, well, everyone is awesome. Everyone does a residency. Everyone does outreach to all this. But I think the fellowship was something that a lot of people don't do. And many program directors were interested in it. So just having the background with these different patients, I think opened a lot more doors for me.
Yeah. So do you think that was the single most game changer?
I also try to reach out to like different mentors and like see what they recommend. Definitely putting my ear to the street, talking to, just using my resources. I had the program director that's here now. He put good words in for me. He helped me like write essays. I got recommendations. So just in general, using my resources.
Good. Okay. So now how many programs did you apply to, and how many interviews did you actually end up getting?
I had 17, I applied to 17 programs, and I got interviews for about 6.
Okay.
And one of them was non-match.
Okay, so about a third of the program.
Yeah.
you applied to, you got interviews at. And from those 6, how did you rank those programs? Did you rank all of them?
I ranked all of them except for the one that wasn't matched. So that ended up being like 6 programs.
Okay. Gotcha. Okay. What would you say? What things help? I know, you know, when you go to programs, there's always ones that you get interviews for. There's always something about the programs you like, of course. But what about the interviews that allowed you to gain a little bit more insight so that you could rank them?
Well, I definitely asked a lot of questions, but I mean, seeing how the residents interacted with each other and how they talked about the program, I guess you could really see like who enjoyed their program and who didn't.
Right.
Also, like the curriculum, the fact that I've been out working for a year or two, I realized what I'm looking for. I want a high volume patient flow, and I also want to have classes, have a structure. So I'm learning what I need to know for my specialty and what I'm going to need to know for boards. So that was, some programs don't have didactic portions at all. Some programs have a lot of didactic and not enough patients. So it really depends on like what you're looking for. And I think the year in fellowship helped me decide what was important to me.
So there's a tip for all of you guys that are applying to PEDO, maybe weren't successful that very first time. The second time, one of the things that you must consider is doing that fellowship. And where's that fellowship that you did?
At Stony Brook University. They have the dental care for the developmentally disabled. And then there's another fellowship at the RFK, the Rose F. Kennedy Center. So they're associated with St. Barnabas. And I think there's about like 5 different programs that rotate through there.
Good.
So you get a taste of all the different programs and see how they like it, how the residents like it.
Right. And for those of you that don't know, where did you match and where is it at?
St. Barnabas is in the Bronx.
In the Bronx. So you'll be coming back to the Bronx.
I'm coming back to the boogie dance.
Coming back to the come up with a Bronx dance now. Whatever that is. Well, that's great. I'm so happy for you. It's been an interesting process. Thank you for allowing me to kind of share and be a part of that process with just kind of, you know, helping you get your application together, getting ready for interviews, questions to ask, and the last piece of just kind of putting your match list together and kind of helping you flush out your ideas and your about the process. I will share with you that was the program. St. Barnabas was the one that I knew that you were going to get into. It was just a feeling. I didn't have like, you know, the program director's telephone number or secret hotline, you know, red phone line or anything like that. But just from talking to you and knowing a little bit about the program, because there are some other residents, current residents, and also in the past that have applied to that program, I kind of had an idea that was going to be your number one choice. And just based on your experience these last 2 years with the GPR training and the fellowship, it sounded like it was going to be a great fit. So I'm so glad you went with your gut and were able to kind of differentiate through the programs to the point where you picked number one, you ranked number one, and they ranked you number one, evidently. Right?
Yes.
So
they did. And I did do what you say. So I did appreciate you helping me and giving me advice. I definitely went to the post office the next day and sent that thank you card. So,
so for those of you that are watching this, if you saw me and Dr. Osbourne when we were going through the rank list, one of the things you'll remember is that I told her, you know, this last week before the rank list is going to come out, I said, you got to do something to get the program director.
It was the week of. I think it was the week of.
It was the week of. I think it was like that Monday or that Sunday.
Yeah, it was due Friday, and I was at the post office trying to send the stuff out like Monday or Tuesday to get there before the rank list
Before
closed.
Friday, yep. And did you send it overnight? Did you have to send it
Yes,
over?
I did. And the postman looked at me like I was crazy. He was like, "Are you sure you want to send this overnight?"
That's
Yes.
right.
Yes, I do.
That's
yes.
right.
It's 20.
And that shows that you're willing to do whatever it takes to make sure that the program director that you got his attention, and to the point where right before he was getting ready to update, change, or modify his rank list, you got his attention so that he could remember you less than 72 hours before the rank list went in. And, you know, we don't know 100% if it worked or not, but all we do know is that it was your number one choice. You got their attention, and you're going to that program. So
yeah,
congratulations. You're too congratulated, and good job. I'm glad some of the tips that I shared you actually implemented and actually worked. So this has been a great success story. Thanks so much, Dr. Osbourne, for sharing this experience. And we want to follow you through your it's a 2-year program or 3-year program?
Yeah, it's 2 years.
2-year program. So we want to follow your progress through your program after your first year, and then also after your second year, and in preparation to become board certified. So hopefully we'll hear back from you soon. If not early in July, maybe in December, just to see how the first 6 months has gone.
Okay.
Awesome. Any other tips or advice that you would give for those students and or docs that are applying to PEDO?
I was reminded today that pediatric dentistry is one of the most competitive dental specialties over ortho and oral surgery. So it's hard work. I mean, to match into a program, but it's really important to never give up and use your resources, keep trying, and if it's really meant for you, it will work out.
There you go. There you go. Straight advice from a recent matched future pediatric dentist, Dr. Osbourne. Thanks so much. And if you guys have, tell us what you think about today's video and the success that Dr. Osbourne has had. Make sure you write some comments down below. If you have questions that you want to ask me or even Dr. Osbourne, send them to me right here at NewDentistCoach@gmail.com, NewDentistCoach@gmail.com. Be sure to subscribe so you can watch videos like this, these success stories that we love for mentorship and helping. And if you want to hear more about these success stories, make sure you turn on your notifications so you get these videos that come out each and every week. Dr. Osbourne, thank you so much. Congratulations. No, very proud of you. I have to share the news with everyone at your Bronx Lev family as well.
Yeah.
You know, and you guys check out this next video right here about PEDO and also about Match. There's another one right here. Check that one out too. And Dr. Osbourne, congrats, and we'll talk to you soon.
Thank you. Have a good one.
Bye.